It's great to see everybody here today, and I just wanted to say I feel very privileged to be the RDM for Division 4. I am a Lancashire girl, born and bred, but I'm very happy to be in Team Manchester, and I'm very happy to be working with you all here. So I was the DeNDRoN manager, and obviously now I am hopefully going to look after dementias and neurodegeneration, mental health and neurological disorders. So a bit of a mouthful, but not as bad as Division 6. I think it's my kind of fourth week in my new role, and certainly, there are challenges for us as a division and as a network, as everyone's kind of alluded to. But I'm really excited about what we can do for patients in Manchester in this division. And I think, we've got some great teams out there, great research teams and great clinical teams, clinicians and researchers who I've worked with and who I'm looking forward to working with, who really support our patients and support the portfolio currently. And it's about how we build on that and how we can sort of give access to more patients in Manchester. There's lots of things happening around dementia at the moment, and obviously that will sort of strengthen our portfolio as well. So it's about how do we address that here in GM. Okay, just to tell us about the team, from a clinical leadership perspective, we've got Professor Catherine Abel, who is our divisional lead, and she is a professor of psychiatry at the University of Manchester and is a lead researcher in women's mental health. So I will be working with her and also these other great individuals that I've listed here. So for DeNDRoN, we've got Dr. Leroy, he's our dementia lead, honorary lecturer at University of Manchester and a consultant psychiatrist at Manchester Mental Health, working with Dr. Silverdale, who I think is definitely in the audience, who's going to be sort of supporting motor neuron disease and Huntington's and Parkinson's aspects of DeNDRoN. For mental health, we have Professor Nav Kapoor and Professor Tony Morrison. So Professor Kapoor is a professor of psychiatry at the University of Manchester, and Professor Morrison is Professor of Clinical Psychology, and they have links with Manchester Mental Health and Greater Manchester West. And obviously together the mental health trusts are working very closely in our division. And finally, we've got Dr. Rogg, who will be supporting the neurological disorders theme in Manchester, consultant neurologist at Salford. So we've got some really great people there, and we're bringing lots of organisations together. So I just wanted to go on to our objectives, really. Again, the HLO7, High Level Objective 7, which is new, which kind of impacts on our division, is about increasing the number of participants in DeNDRoN. And that's really sort of on the back of the Prime Minister's challenge on dementia and the fact that dementia research was underfunded, and obviously the government has invested quite a significant amount of money, and there's lots of research funding opportunities out there, and hopefully lots of studies that our patients can get involved with. So we've done very well in the North West as DeNDRoN, and I think it's just about building on that and increasing the numbers there. We've got some specific objectives for each of our specialties. So join dementia research, which I hope you'll hear lots and lots about at the end of this year. That's a national initiative with the Alzheimer's UK, and that's about patients and carers signing up to the Joint Dementia Research System, where they'll give some details if they're experiencing memory problems. They'll give some details about their diagnosis, and they'll go on to this database, and hopefully we'll be able to match them to studies, hopefully here in Manchester. So there'll be lots of publicity around that, and there will be a big campaign around that towards the end of the year, and it's about how we support that as Division 4. Again, for DeNDRoN, there's something around specific assessments we do with patients and how we make sure that the fantastic workforce that I am working with keeps those skills up, and that's the same in mental health as well. We have another initiative which I think will impact on other divisions as well, is around enabling research in care homes. So that obviously is something that DeNDRoN Coordinating Centre started off with, but that can impact on patients with in different disease areas, and that's really about how we can get care homes and nursing homes ready so that we can deliver the research out there, and that's what we're trying to do. And I'm really excited to say we've got one study that's going to kick off in a couple of months that will really kind of see how that can work in practice. So I'll hopefully be able to tell you how that goes next year. And then finally, around sort of increasing our clinical leadership capacity and engagement, I think what DeNDRoN and other specialties have done very well is, as a network, we've linked in nationally with researchers from different parts of the country, and it's about how we sustain that and how we put together collaborative funding bids and how that we can get those studies on the portfolio. So it's about keeping, making sure the systems work in Manchester, but also linking in with our colleagues in the other 14 LCRNs. Mental health, as I said, about the assessment, so just making sure that we keep up those skills. But essentially for mental health and neurological disorders and right across the division, it's about how we can support commercial studies, which maybe we haven't necessarily done so much in mental health before. So it's about, if there are particular studies, how can we run them in Manchester? And certainly for neurological disorders, we're already working really well with Salford in terms of supporting that part of the portfolio. So it's just about how we increase that. So I haven't got the table and the graph, but I have just got the bottom line. And the bottom line is we're 9th out of 15 at the moment across the division. So the only way is up, and that's a favourite song of mine. I think that's where we are. But I think we'll have a fantastic year. And for the next steps, just in the kind of the next sort of 2, 3 to 6 months. Just going to look at the portfolio, map our resources and our experience and expertise across Greater Manchester. We've got to make sure we're maintaining what we currently do, but just looking at ways how we can improve that. And obviously bearing in mind that dementia is priority for 14-15 as well, and how we support the dementia DeNDRoN studies. And just looking a little bit around our capacity and capability, because as I said, as the pipeline gets stronger, we need to be able to deliver those types of studies in Manchester, and we maybe need to look at supporting new investigators and developing those sites so that we can do that. So thank you very much, and I'm very pleased to reintroduce Sarah to talk about Division 5. Thank you.